Organs of the respiratory system: nose, pharynx, larynx, trachea, bronchi, lungs, alveoli. Figure 13.1. Function of the respiratory system: oversees gas exchanges between the blood and external environment. Exchange of gases takes place within the lungs and the alveoli. Passageways to the lungs purify, warm, and humidify the incoming air. The nose, the only externally visible part of the respiratory system. Air enters the nose through the external nares, nostrils. The interior of the nose consists of a nasal cavity divided by a nasal septum. Upper respiratory tract. Figure 13.2. Anatomy of the nasal cavity. Olfactory, smell, receptors are located in the mucosa on the superior surface. The rest of the cavity is lined with respiratory mucosa. Moistens air. Traps incoming foreign particles. Anatomy of the nasal cavity. The nasal cavity is separated from the oral cavity by the palate. Anterior hard palate, bone. Posterior soft palate, muscle. Paranasal sinuses, cavities within bones surrounding the nasal cavity. Frontal bone. Sphenoid bone. Ethmoid bone. Maxillary bone. Paranasal sinuses. Function of the sinuses: lighten the skull. Act as resonance chambers for speech. Produce mucus that drains into the nasal cavity. Pharynx, throat, muscular passage from nasal cavity to larynx. The upper and middle pharynx are common passageways for air and food. Larynx, voice box, routes air and food into proper channels. Plays a role in speech. Made of 8 rigid hyaline cartilages and a spoon-shaped flap of elastic cartilage, epiglottis. Structures of the larynx. Thyroid cartilage. Largest hyaline cartilage. Protrudes anteriorly, Adam's apple. Epiglottis. Superior opening of the larynx. Routes food to the larynx and air toward the trachea. Structures of the larynx. Vocal cords, vocal folds. Vibrate with expelled air to create sound, speech. Glottis, opening between vocal cords. Trachea, windpipe, connects larynx with bronchi. Lined with ciliated mucosa. Beat continuously in the opposite direction of incoming air. Expel mucus loaded with dust and other debris away from lungs. Walls are reinforced with C-shaped hyaline cartilage. Primary bronchi formed by division of the trachea. Bronchi subdivide into smaller and smaller branches. Lungs occupy most of the thoracic cavity. Apex is near the clavicle, superior portion. Base rests on the diaphragm, inferior portion. Each lung is divided into lobes by fissures. Left lung, 2 lobes. Right lung, 3 lobes, lungs. Figure 13.4b. Coverings of the lungs. Pulmonary, visceral, pleura covers the lung surface. Parietal pleura lines the walls of the thoracic cavity. Pleural fluid fills the area between layers of pleura to allow gliding. Bronchioles, smallest branches of the bronchi. Terminal bronchioles end in alveoli. Figure 13.5a. Capillaries. Alveoli. Gas exchange takes place within the alveoli in the respiratory membrane. Pulmonary capillaries cover external surfaces of alveoli. http://www.sciencefriday.com/program/archives/201006252. Scientists building a real lung. Build a lung model. Gas exchange. Gas crosses the respiratory membrane by diffusion. Oxygen enters the blood. Carbon dioxide enters the alveoli. Events of respiration. External respiration, gas exchange between pulmonary blood and alveoli. Respiratory gas transport, transport of oxygen and carbon dioxide via the bloodstream. Internal respiration, gas exchange between blood and tissue cells and systemic capillaries. Gas transport in the blood. Oxygen transport in the blood. Inside red blood cells attached to hemoglobin, oxyhemoglobin, O2. Mechanics of breathing, pulmonary ventilation. 2 phases. Inspiration, flow of air into lung. Expiration, air leaving lung. Inspiration, the diaphragm and intercostal muscles contract. The size of the thoracic cavity increases. External air is pulled, not sucked, into the lungs. Figure 13.7a. Expiration. Largely a passive process which depends on natural lung elasticity. As muscles relax, air is pushed out of the lungs. Forced expiration can occur mostly by contracting internal intercostal muscles to depress the rib cage. Expiration. Figure 13.7b. Non-respiratory air movements can be caused by reflexes or voluntary actions. Examples: cough and sneeze, clears lungs of debris. Laughing. Crying. Yawn. Hiccup. Respiratory sounds are monitored with a stethoscope. Bronchial sounds, produced by air rushing through trachea and bronchi. Vesicular breathing sounds, soft sounds of air filling alveoli, factors influencing respiratory rate and depth. Physical factors: increased body temperature, exercise, talking, coughing, volition, conscious control. Emotional factors: emphysema, alveoli enlarge as adjacent chambers break through. Chronic inflammation promotes lung fibrosis. Airways collapse during expiration. Patients use a large amount of energy to exhale. Overinflation of the lungs leads to a permanently expanded barrel chest, chronic bronchitis. Mucosa of the lower respiratory passages becomes severely inflamed. Mucus production increases. Pooled mucus impairs ventilation and gas exchange. Risk of lung infection increases. Pneumonia is common. Lung cancer accounts for 1/3 of all cancer deaths in the United States. Increased incidence associated with smoking. 3 common types: squamous cell carcinoma, adenocarcinoma, small cell carcinoma. Sudden infant death syndrome, SIDS. Apparently healthy infant stops breathing and dies during sleep. Some cases are thought to be a problem of the neurorespiratory control center. 1/3 of cases appear to be due to heart rhythm abnormalities.